Inspire FM in Luton, Bedfordshire, 105.1 FM. As usual, it's an absolute delight to join you on my favourite day of the week. Why is it my favourite day of the week, you may ask? It's my favourite day of the week because I have your company with me. What a hectic week it has been, for reasons that I can't quite say on the radio, because I have my eager station manager who's sat with me, who tells me what I should be doing and what I shouldn't be doing. So it's been a very hectic week indeed with regards to my clinical commitments. And if you already don't know, I am a GP within the local city of Peterborough in a wonderful practice. And I think it's the best practice in Peterborough. But again, I'm biased, aren't I? So I will say so. It's wonderful to have you all. Once again, I hope you're enjoying the weather. And once again, I hope you're going to give me your glorious company and text us and WhatsApp us by joining in the show on 07745 278978, or you can ring us on our studio telephone number on 01733 602 133. Indeed, you can watch us on Facebook Live, Twitter Live and YouTube Live. We are clever clogs over here, so we've got all of these means for you to see us so you don't miss a single episode. Now, I really did think about this topic this week. And I know I always say that, don't I? That I've really thought about this topic this week. But no, it's not that I really did think about it. I think that what we do is I tend to ask a lot of the people around me, my professional colleagues, who are situated all over the United Kingdom through various groups, forums that I'm attached to. And I can tell you that I'm so blessed to know so many people in this professional field. And the reason why it's a blessing is that they very kindly volunteer their time to come onto these shows and to impart their knowledge to the local population. And the Body Health and Mind Show, I'm very happy to say, is not only listened in the United Kingdom, but we have far-flung countries such as Europe, Sweden, Indonesia, India, Pakistan, Saudi Arabia, and Canada, and even the United States. So how wonderful is that? So this week had a really good idea about talking in regards to something that is ever so popular, I would say, as a topic, and it's extremely common. It's so common that I think nearly 1 in 4 people or young people that comes into my surgery would have had this at some point in their life. And we're going to be talking about anemia. But I need the perfect guest to do so, and the perfect guest that I have on my show is none other than Dr. Ishfaq Ahmad, who I'm so happy has come on my show before, and again he's come back onto my show. I'm going to introduce him. He's MBBS, MRCP, FRCP, and he's a consultant gastroenterologist at the Worcestershire Acute NHS Trust. He's also an examiner at the Royal College of Physicians. He's also been an ex-clinical director for Worcestershire Colorectal Cancer Services. And he does extra extensive community work that he's undertaken. And he's set up a free matrimonial service for Muslim professionals, as well as creating health awareness, in which he has recorded several programs on YouTube on various health topics in Urdu and English. I see him numerous times on the television for Pakistani programs. He also imparts and undertakes education and training for overseas students in Pakistan, about 4 to 5 days and even more every year. He's been awarded Physician of the Year 2015 by Association of Pakistani Physicians and Surgeons UK, and he was a Doctor of the Year finalist 2016 at the Worcestershire NHS Trust. He has also been awarded Clinical Excellence Awards Level 5. Dr. Ishfaq Ahmad, Assalamu alaikum.
Walaikum salam. Thank you very much for your invitation again. It's always a pleasure to be. There is slight interruption in the voice. I think your voice is a little bit interrupted.
Ah, I see. So we'll try and get our station manager to have a look in that. So Brother Kazim, if you don't mind having a look at our voice and trying to fix things, then that would be great. Obviously I've done something right for you to come back and get a second time to be my guest. Thank you very much for that.
Thank you very much for it. I
think what we're going. Can you hear me now?
The voice is very interrupted. I can't.
Okay, so what we're going to try and do is we're going to try and get you back on... We're going to try and get Dr. Ahmad back on the telephone where he can hear me a little bit properly, but we have his video in the background, which is wonderful. In the meantime, when we try to get Dr. Ishfaq Ahmad back, we're going to talk a little bit about the topic of anemia today, which is, you know, a very common topic indeed. The fact of the matter is we'll be talking a little bit about what the causes of anemia are and which population it's more prevalent in. We'll be talking a little bit about the causes as well. So in order for us to do that, we'll be able to get Dr. Ahmad and his expertise. Now, Dr. Ahmad has a background of being one of the consultants in the Worcestershire Acute NHS Trust, as you know. The last time he came on, we spoke a little bit about hepatitis. Indeed, I think that we were going to do some and I think we've got Dr. Ishfaq Ahmad back. Assalamu alaikum, Dr. Ahmad.
Walaikum assalam.
Can you hear me now?
Yes, I can hear you now.
Oh, that's wonderful. So it's wonderful because this is so clever. We've got not only the fact that we've got Dr. Ishfaq Ahmad, but we are able to get his voice now, which is wonderful. So I'm really sorry about that interruption, but we'll go back to, I said that I must have done something right for you to come back on my show again.
It's always a pleasure to be on your show. Alhamdulillah, you're doing a great job for the community.
Oh, thank you, as are you. But I'm rather envious, you see, because you are excelling very fast in the world of online, I would say, media, the real media, television. I mean, wherever I look on my social media, you see Ishfaq Bhai there. So that's fantastic. You're even more famous than I am.
No, I'm not famous. I'm just trying to help a little bit, really, just to improve the awareness, health awareness, and various training programs. So just a little bit of effort. It's just finding a time. Yeah. Luckily, today finished my on call, so usually Wednesday is quite a busy day for me. So it's nice to be at your show again.
Thank you, and I really hope that we will be able to make the most of the time, Dr. Ahmad. So coming back to our topic, we've got a lot of listeners, and indeed, if you want to talk a little bit about this topic, what do you know about anemia? Are you somebody who suffers from anemia? Do you feel tired? Do you suspect you have anemia? If there are any questions you'd like to ask us in this regard, please don't hesitate to call us on our studio telephone number of 01733 602133, or you can ask me underneath the Facebook video page and we will endeavour to answer those questions. So, Dr. Ahmad, for the purpose of our listeners, could you give a little bit of an introduction about anemia itself? What is it?
Anemia basically is it's derived from the word anemia is derived from a Greek word meaning lack of blood. So if there is a lack of blood in the body, because the blood, blood means red blood cells. Okay, there are 3 cells in the blood: red, white, and platelet.
Okay.
And whenever there is a less red blood cells, so then the blood count goes down, and we feel a little bit tired, lethargic, pale, breathlessness, palpitation, chest pain, depressed, so various kind of symptoms. So it's basically whenever there is a reduction or lack of red cells, which basically provides oxygen to every part of the body. So when there is a shortage of red cells, so the body does not, various organs does not get oxygen, and then we feel miserable. I mean, it's a very, very common condition. I think you mentioned about 1 in 4.
Yeah.
I would say approximately 10 to 15% of population of any age will suffer from anemia at some stage in their life.
Right. Well, those are quite enormous statistics in a way affecting the population. And in regards to anemia itself, there are various types, aren't there, Dr. Ahmad?
Yes. I mean, if broadly speaking, if we can sort of our body is a kind of factory which produces these red cells every 4 months. All these red cells are replaced every 4 months. And for the listener, if I can tell them, just for the educational purposes, our bones are the factories for the blood. So the blood is produced inside bones, the big bones like leg bones and hip bones. So these are our factories to produce red cells.
Okay.
And whenever there is either an excessive loss of red cell, which can be in the form of blood loss, or there is a problem with the production of red cells, or excessive destruction of the red cells. So these are the mainly three types of anemia. We can also sort of subdivide into the three types of anemia depending on the size of the red cell.
Mm-hmm.
If the red cell is normal size, so that is called normocytic normochromic anemia.
Okay.
That is usually due to some kind of underlying chronic disease like chronic infection, rheumatoid arthritis, any problem with the kidneys, liver, or thyroid.
Mm-hmm.
And the second category is when the red cell size is smaller, that's called microcytic. And this is particularly the important type of anemia that is called iron deficiency anemia.
Okay.
And there are various causes of that. We can go through in details later on.
Okay.
And the third type of anemia is when the red cell size is bigger, what we call is the macrocytic anemia. And that is usually due to the lack of a couple of vitamins which are necessary to form the red cells.
Right.
So there are three main ingredients to form these red cells. Iron is one of them, B12 is the second one, and the folic acid is the third one. So
Right.
these three ingredients are very important to form the cells. So if any of these ingredients are lacking, either in a diet or due to some excessive loss, then the person will develop anemia, depending on what kind of deficiency it is, and then they will develop that type of anemia.
Right. And with regards to iron deficiency anemia, which is probably one of the most or more common ones that you probably see within your practice, there are various causes for it as well, and it's the one that you can most likely have as a result of decreased dietary intake as well. Isn't that correct?
I mean, if we can sort of go through the iron deficiency anemia, so the commonest type of iron deficiency anemia occurs in females of menstrual age and also the pregnant ladies. So
Okay. And with regards to the dietary intake, I've started to see, and I'm not sure if this is something that obviously you deal more with adults, but indeed in my general practice I've started to see a lot more iron deficiency anemia with regards to children as well, because you have fussy eaters, etc. And I see a lot of iron deficiency anemia in children too, Dr. Ahmad. Dr. Ahmad? I think we've lost Dr. Ahmad again. So what I'm going to do now is we'll continue to talk. So let's recap a little bit upon what Dr. Ahmad has said to us. So I think what has happened is we've just lost him. Brother Qasim is endeavouring to get him back again. And Dr. Ahmad was emphasising on the fact that the most common type of anemia is iron deficiency anemia, and it can be caused in a variety of conditions. Now, there are dietary conditions where you see anemia at a very young age in children. You also see this type of anemia within women who are menstruating and have their monthly cycles because of blood loss. They can also have this type of anemia too. And also the actual fact of the matter is you can have blood loss in elderly people through a slowly bleeding ulcer, etc., or other causes of bleeding. And having an iron deficiency anemia can also be in later ages, coupled with other signs and symptoms, can also be a cause for investigating cancer as well. So thank you very much, Dr. Ahmed, for joining us again. We do apologise. There is something going on today, but we're glad to have you back. Can you hear us?
Yes, I'm sorry about that. I think there is some problem with the technology, which always a little bit of nuisance. If it works very well, then it's fine.
Yes, that's
going back to the iron deficiency anemia, what we were discussing is the commonest type of iron deficiency anemia occurs in females,
yes.
Particularly young females who are menstruating, and during their menstruation there is a lot of blood loss. And also young ladies who are pregnant, because the requirement for all these vitamins during pregnancy goes up significantly. So this is a commonest type of iron deficiency anemia, which is, we may call it a physiological anemia. Right. Thirdly, worldwide, but not in UK, the hookworm infestation, this causes a iron deficiency anemia as well.
Right.
So if we take these three things out, because pregnant women and women during the menstruation age does not require any investigations unless they have got any particular gastrointestinal symptoms.
Sure.
But anemia, iron deficiency anemia in men require urgent investigations, or postmenopausal women, because there is a small possibility of around 10% that they may have underlying serious condition like cancer. So hence iron deficiency anemia in postmenopausal women and men of all ages, we take it quite seriously, and under NHS it is classed as a red flag sign or symptom that in primary care, if you do find iron deficiency anemia in these age group, there's a usually 2-week wait pathway referral for an urgent investigations in the secondary care to find out the cause of underlying iron deficiency anemia.
Okay. And with regards to iron deficiency anemia, say we have a simple case of iron deficiency anemia in a young lady who is having her monthly cycles, which are considerably very heavy.
Yes.
And what would be your first course of action, obviously, with her? And we know that she is specifically deficient, not very good with her diet. Do you actually advise such women to concentrate on diet, or do you treat with iron straight away?
I mean, first of all, I think we have to make sure that there isn't any the symptoms of with the stomach or the bowel. So if they're entirely asymptomatic from that point of view, and then we can sort of take a little bit of details whether the dietary intake of iron, food rich in iron, is enough or not. And I think if they're not taking it, I mean, some people don't want to take any supplements.
Yeah.
But on the other hand, they have to modify their diet to get all these iron-rich foods.
Yeah.
So I mean, you can try the food first. Usually, it might take a couple of months, and if there is an improvement, then they can continue with their food rich in iron. But on the other hand, I think we must try. Suppose if they're having heavy periods, we could address that as well. I think these days, you know better than me, that menorrhagia or heavy periods can be dealt with some kind of medical treatment.
Yeah.
So the dietary modifications are helpful, but usually may not be sufficient in majority of the patients, because I think they don't like to eat too much meat and too much vegetables.
Yeah, yeah. And would you be able to emphasize on what is an appropriate diet that is rich in iron for people who have iron deficiency, please, Dr. Ahmed?
I mean, basically all meat and poultry, egg, and dark green leafy foods, vegetables, they are very rich in iron. So they have to consider these foods.
Yeah. Okay, and I usually say to my patients, because we have a very large Asian demographic, and in that demographic, the staple diet, as you know, is usually chapatis with a curry. And one of the things that I usually do stress to my patients are that with the cooking of such foods, especially the green leafy vegetables, some people like to have spinach, the quantity of iron that you have in that food isn't, the availability of it is cut down due to the process of cooking. So I sometimes signpost them to dried fruit, for example, raisins, apricots, prunes, currants and figs, and whole grain bread, cereals, eggs as well, and fish. They're quite rich in iron. But the other scenario that I've come across quite often, Dr. Ahmed, is that there are some people that have a low ferritin when we do these labs or tests in the surgery, but their hemoglobin is normal. We then are such people, they still present with feeling symptoms of being tired. Are those people classified as being iron deficient anemia or no?
No, if their hemoglobin, blood count hemoglobin is normal, then the levels for the hemoglobin for the male is 130 to 140, and for the female 120 to 130.
Correct.
If the levels of the hemoglobin are normal, then we can't call them anemic. But if their iron stores are low, we can say that they are iron deficient but not anemic.
Correct.
Usually these patients do not get much of the symptoms. As long as the blood count is more than 100, the chances that low ferritin causing anemia are very small.
Right. And then obviously, we are approaching a break in a short while, but obviously we do have that population of patients who we discover won't get better with 3 months worth of iron. They're still anemic. Is it at that time that we then send them to consultants like yourself, gastroenterologists, to have a look at?
Are we talking about the females now?
Both male and female.
I think there's a slight difference. If there is a male and who is iron deficient, he should be referred any age.
Oh, irrespective of age. Okay.
Irrespective of the age, even if it's 20, 30.
Okay.
Because there are a few other conditions apart from cancer. I mean, the chances of finding a cancer is around 8 to 10% in patients with iron deficiency anemia.
Okay.
But there are several other causes of anemia in these patients. They might be losing some inflammation in the stomach ulcers, or they may have a condition, what we call is where the patients are intolerant to wheat product, a condition called celiac disease.
Right.
So I think for the male patient of any age, if they are iron deficient or anemic, they should be referred for investigations.
Right.
For the female patients of menstruation age, you can try, if they have got no gastrointestinal symptoms like abdominal pain, vomiting, weight loss, diarrhea, or bleeding through the back passage, then you can sort of try either dietary modification first. You can give them iron supplements, and if after 3 months of iron supplements, if their blood count is still not getting better, then I think that there are ways of boosting it further, particularly if we advise them to take vitamin C or orange juice with iron pills.
Yeah.
Because that actually increases the absorption of iron into the body. And another option is that if they chronically remain low, provided we have addressed the underlying problem, that if they're having heavy periods, I think we can address that. So by treating the heavy periods, we can actually bring the hemoglobin blood count back to normal anyway. But there is another way of bringing the blood count up, is that some patients do not tolerate iron supplements because the iron causes abdominal pain, causes constipation.
Yeah.
A significant proportion of the patients cannot tolerate it.
Okay.
There is these days we can give the iron infusion in the form of a drip. It only takes 20 to 30 minutes.
Okay.
And one drip is enough to bring the iron level, the blood count level up to normal for a significant period of time.
Okay. Well, that was all very interesting. And we've got 30 seconds to our break. So if you've just tuned in, do call us on Salam Radio 1733 We want to hear, are you anemic? Have you had any experience of being anemic? And what were the symptoms that you felt that you had? Don't go away. Join us again for this very interesting program on the Body, Health and Mind Show with your very own Dr. Shabina Asad Qayyum.
Have you visited Amar Food Store yet? Now open at Lincoln Road Triangle, 613B Lincoln Road, Peterborough. Pay us a visit and take advantage of our special offers and great range of products on groceries, vegetables, fruits and halal meat. All your favourite brands under one roof. We take payment by card, have free customer parking and offer a free local delivery service. Also available, Payzone for bill payments and money transfer services to Pakistan. Amar Food Store and Halal Meat. Now open at Lincoln Road Triangle. Call us on 01733 68 73 74. High in quality, low in prices.
Third world and developing countries are home to some of the most vulnerable children on the planet. Malnutrition, severe lack of medical aid and access to clean water are just some of the horrific challenges faced by orphans across Africa and Asia. Children of Adam, a Peterborough charity, need your help to bring aid to these orphans for just £25 a month. To sponsor an orphan or assist with other projects, please call 0300 321 0032 or visit www.childrenofadam.net.
Need a great place to chill out? Look no further than The Lounge for quality food and drinks at a great price. Try our varied menu: pasta, seafood, burgers, grills, salad, soup, rice and sides. Also hot and cold drinks, milkshakes and mocktails. Leave room for our exquisite desserts. The Lounge, 417 Lincoln Road, Peterborough. Call 01733 709 306 to order for delivery. The Lounge, friendly service with a great atmosphere.
Gems and jewels. Wise sayings, interesting events, and moral lessons from Islamic history. He deserved a large endowment.
During the days of Hisham ibn Abdul Malik, a group of Arabs came to his court but were afraid to speak to him. Among them was a young man named Dirwas ibn Habib, who was only 16 years of age at the time. Hisham spotted him among the group and said to his guard, "Now, anyone who wishes to enter and meet me may do so, even young children." Dirwas jumped forward and said, "O leader of the believers, the second year ate away our flesh, and the third affected our bones. In your hands you have surplus money. If that surplus is for Allah, then divide it among his slaves. And if it belongs to them, then why do you prevent that wealth from them? And if it is yours, then give it in charity to them. For indeed, Allah rewards those who give charity." Hisham said, "In each of the three scenarios, the young man left no excuse for me. He ordered for the group to be given 100,000 dinars, and for that young man to be given 100,000 dirhams."
Peterborough's community radio station, Salam Radio, 106.2 FM.
Assalamu alaikum. Welcome back to your very own Dr. Shabina Sidkium's Body Health and Mind Show on Peterborough's only Muslim radio station, Salam Radio 106.2 FM and Inspire FM 105.1 FM. So before the break, we had the wonderful Dr. Ishfaq Ahmad, who is a consultant gastroenterologist at the Worcestershire Acute NHS Trust. And we were talking about anemia. Before the break, if you've just joined in and tuned in, we were talking about iron deficiency anemia comparatively. And just before we went on the break, Dr. Ahmad was talking about if the iron supplements, which some people are quite intolerant to, can cause side effects, or if their iron levels aren't at par, they can then have an infusion of iron as well. And Assalamu alaikum, Dr. Ahmad, thank you very much for bearing with us. We did lose your video, but we need to have you back on again so that people can see who's speaking. And I wanted to ask you that these iron infusions, a lot of people inquire from their GPs. Now, a lot of people ask, do they need to be referred specially to have an iron infusion done, or is it just sort of a straight referral into hospital?
I think these are usually done as a day case. There was a slight problem with iron infusion in the past. When they were old preparation, the risk of allergic reaction was slightly higher. So hence, I think majority of the primary care physicians, including secondary care physicians, are a bit reluctant still to give iron infusions. But the newer preparations are very clean.
Okay.
They are very less allergenic, so they causes minimal allergic reaction. So usually we give a test dose for 5 minutes, and if there is no problem, then the 20 minutes, the rest of the dose is given over 20 to 30 minutes. The referral pathways are different in various hospitals. You can actually send the patient directly to hematologist, gastroenterologist, or MAU physician to consider iron transfusion. It's only a half an hour, the duration, and the patients usually start feeling better within a few days' time.
Yeah,
and they usually do not require any further, provided their underlying issues has been sorted out. They usually do not require repeated iron transfusion, except few patients, like patients with the chronic kidney problems. Or patients who have got problem with the production of the red cells, so they might need iron transfusion on a regular basis.
Right. And with regards to symptoms, because we've spoken a lot about it, and probably this was one thing that I failed to ask you for the knowledge of our listeners, what are the main cardinal symptoms of somebody who's suffering from a full-blown iron deficiency anemia in which their hemoglobin is actually low?
Anemia of any type, either is iron deficient or either is a B12 folic acid deficient, anemia of any type, the symptoms would be fairly consistent throughout the board. They will have exactly the same symptoms. It's usually the tiredness, feeling very weak and lethargic, no energy, and if you're doing a little bit of exertion, you will have breathlessness, palpitation, people can get chest pains, and even anemia can be associated with a heart attack as well, because the red cells which provide oxygen to the heart muscles, if they are lacking, so if there isn't enough oxygen going to the heart muscle, and we do see time to time patients presenting with a heart attack who are anemic, and this is the first time their anemia has been found out. So I think the symptoms is fairly non-specific, and people don't take it significantly, or they think, I'm doing too much work. I was busy at work, so that might be the reason I'm feeling tired.
Yes, that's right.
They usually look a little bit pale as well. So if somebody is looking pale, I think and feeling tired, they should go and come and see you and have their blood test performed.
Yes, that's right. And coming from a consultant's perspective, where you see people with anemia, Would you be able to elaborate a little bit upon how you investigate those people who, say, have an anemia of an unknown cause? That's how you usually get to see your patients, isn't it?
Yeah. Basically, the first thing we look at is, the blood test you have kindly done already. And we simply look at the type of anemia. As in the beginning we discussed, it could be large cell, which usually is due to B12 and folic acid deficiency. And we usually don't need to do any investigations in those cases. We can simply check their B12 folic acid, and if they are deficient, we can give them supplements.
Right.
And if they are iron deficient, small cell anemia, then where the red cells are smaller in size, in those individuals, usually we have to arrange an examination of the stomach and the large bowel, an endoscopy procedure called gastroscopy and the colonoscopy. So these are the two basic first-line investigations for patients with iron deficiency anemia.
Right. And talking about gastroscopies and colonoscopies, I've had quite a few patients, which is one of the reasons why it would be wonderful for you to give a little bit more detail on those examinations. So a colonoscopy or a sigmoidoscopy is a camera test that takes place through entry from the rectum or the back passage. And people are very frightened of this procedure. I've had some people who've actually DNA'd or did not attend their appointments because they are frightened of what it entails. Would you be able to give a bit of information about what this entails or how much discomfort is experienced by the patient?
Let's start from the top. First of all, there is a gastroscopy, which is an examination of the stomach. It takes just around 10 minutes, and patients who are very nervous, they can actually ask for or request for sedation. Sedation, basically, they become a little bit amnesic, and they don't remember the procedure, what happened during the procedure. So I think if those patients who are a little bit anxious, they should consider or request whoever is performing the procedure a sedative drug. Only issue with the sedative drug is that you cannot drive back. You cannot drive for 24 hours. So that's the only restriction with the sedation. Procedure is very safe. There is a little bit of discomfort or bloating and a pain, which is very short-lived because we have to insufflate a lot of air into the stomach to expand it to have a look around properly.
Right.
So that discomfort and pain goes away the moment we take the equipment, the camera out of the stomach. We take the air out as well. So that discomfort goes away immediately. There aren't any long-term effect or any damage to the stomach. The risk of complication with any kind of endoscopy procedure is around, I would say, 1 in 3,000 that we may cause some damage to the lining, or what we call as a perforation of the stomach. So that is a very, very tiny risk. It's much, it's less risky than driving. Driving, we drive car every day to the work or to various places. So that is more risky than having an endoscopy procedure.
Right.
Going back to the lower bowel examination, I think the first step is obviously there is some dietary modification we have to do.
Sure.
So we have to reduce the amount of high-fiber food, and there are some restrictions on the diet for about 3 days. And followed by there is a very strong laxative that patients have to take. And that laxative is very, 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 very strong. That flushes out everything.
Right.
The whole concept is that there should not be any residue left in the large bowel. So the procedure or what we call is a colonoscopy, which is a large bowel examination, which is performed by pushing a very flexible camera through the back passage, and it examines whole of the large bowel. Because if the person is anemic, really, they should have a full examination rather than limited examination, which is called sigmoidoscopy.
Right.
And a full examination takes around half an hour. There is a little bit of pain during the procedure, and we do give a very strong painkiller. morphine-based painkiller to control the pain during the procedure.
Wow.
And that pain is very short-lived when we negotiate the corners, because the bowel doesn't like things going up, because it's meant to be pushing the things out rather than things going up in the large bowel. But the procedure takes half an hour. Again, there is this tiny risk of complication like perforation, and the risk in the large bowel is around 1 in 1,000,
Right.
which is, again, still safer than driving a car.
Absolutely. So that was very informative, because I often get asked this question a lot, and I say, yes, I've heard that it's an uncomfortable procedure. I do tell them how a gastroscopy feels, because I've had 2 myself, and
All right, okay.
I know
Well,
how that feels. So I take my pen out and I say to them that look, the tube is probably not even as wide as this pen, depending upon the width of the pen. So I tell them that, you can ask for this sedative. Some people have a bit of midazolam. Some people choose not to. I chose to have it every single time. And I really couldn't remember what had happened afterwards. So yes, you're absolutely right. Dr. Ahmed is right. You can't remember what happens afterwards. And it's wonderful to see you all joining. We've got Dr. Azhar Chaudhry who's joined. Assalamu alaikum. Dr. Mumtaz Hayat, thank you very much for joining us. Miss Maha Nazir, thank you very much for joining us. We've got Dr. Mohammed Pervez, Brother Bilal Javed, Dr. Shakil Puri has joined us, and all of you who have listened to us, thank you so much. And we have Dr. Fareed Latif who's watching us. Assalamu alaikum to you, and welcome to Salam Radio, and thank you for listening. So we're having this wonderful talk about iron deficiency or anemia, and I've got a question from a sister Salma who says that I have anemia which never gets better. My ferritin is consistently low, but my HB is normal. So you're actually iron deficient as opposed to being anemic, Sister Salma. And I have been on iron supplements for 6 months. What can I do?
I mean, has that been investigated, that what was the cause of the iron deficiency is?
Yes.
So I think the first thing would be, if the iron deficiency has not improved with the 6 months of supplements, then it should be investigated. Is it heavy periods causing this problem, or there are any other cause of the blood loss from the stomach or the large bowel? So I think I would suggest that there should be some investigations carried out, and if the cause is found, then we deal with that cause, underlying problem, like if there is inflammation in the stomach or ulcer or polyps in the large bowel or abnormal blood vessels. We deal with that problem, and that resolves the issue of iron deficiency.
Okay.
So I think it will be better to get at the bottom of the problem, that what the cause of iron deficiency is.
Okay.
If the supplements are not helping.
Of course. So I hope, Sister Salma, that has helped you. We have another question from a brother Atif from Luton, who says, does donating blood cause a stimulus in blood production, and can that get rid of anemia?
Giving a blood donation, we should all try to do it, because as I mentioned earlier, the whole of the blood is replaced every 4 months.
Yes.
So if you donate 1 pint of blood every couple of months, that will not cause anemia.
Right. Okay.
But if you're donating too much blood, obviously the blood bank won't accept too much blood donations. I have got a couple of patients referred to us with anemia, and one of them said, I wanted to give 500 total, and I've done 460.
Wow.
And he was so iron deficient, he was anemic.
Oh, goodness.
I said, for God's sake, no, please do not donate any more blood. But donation of blood every 3 to 4 months, 1 unit, does not cause anemia.
Okay, which is wonderful, because there's moderation in everything. It's a little bit what I say with people. There's always moderation involved in everything, in your lifestyle as well. there are people who choose to be vegetarian, but at the same time, there is merit in having a balanced diet with a good proportion of meat, vegetables, fruit, etc. And trust me, I have seen people who are vegan who are very much deficient in other supplements as well. So moderation in everything is key, isn't it, Dr. Ahmed?
Yeah, I mean, for the vegans particularly, those are particularly at high risk of developing anemia. But these days, if they pick up the diets which you mentioned, the nuts and cereals and dark green leafy vegetables, and I'm sure they can overcome the deficiency by not eating any meat products. So they still can have enough iron. So it's approximately 10 milligram is needed every day. So if their vegetable diet is rich in, the food containing iron, more iron, and I'm sure they will not become anemic.
Okay. I have another question here from a brother Ali from Luton, who says that I was told that my body is unable to absorb iron adequately, and therefore taking oral supplements isn't going to do the trick for me. I have had a succession of iron infusions which have been extremely painful. Is there a reason why I am unable to absorb iron adequately?
I mean, I'm not sure whether this brother suffers from a condition called celiac disease.
Right.
But unless, I think if there is an issue with whether he has got small gut or she had any operation on the small bowels in the past, because if you lose with operation or due to any disease a small bowel, then the absorption will go down.
Right.
And somebody with the normal small bowel, I think it's very rare to have a problem with absorption.
Okay, but he's been given iron infusions, so the assumption probably would be that he has a iron deficiency, but he cannot absorb. I'm not too much of a specialist, but I've yet to hear of anybody who doesn't properly absorb iron in the absence of an underlying condition. To be given iron infusion. Would I be correct in assuming so?
That would be correct. I mean, there are other possibilities. I mean, some patients with chronic kidney disease will be iron deficient as well. I mean, they usually require repeated infusion of iron. But somebody who hasn't had any any problem with their small bowel, never had any operation on the small bowel, and they don't have got this celiac disease, which is wheat intolerance, so really the absorption should not be a problem. If there isn't a problem with absorption, then there must be some underlying cause of this malabsorption. That what is the reason behind it? And I think they should, or his physician should focus on to finding out why he is not absorbing iron. Is there any problem with absorption in the small bowel? Is there any illness in the small bowel? Or is there any disease in the small bowel causing this malabsorption? So I think that should be addressed. If he had any kind of operation or inflammation of the small bowel, then that is not the issue. I mean,
okay.
Usually if you have got a short small bowel or any disease or inflammation of the small bowel, then there will be a problem with absorption. Okay. In that case, iron transfusion is required. But, I mean, I'm not sure why the iron is painful. Usually we don't find majority of our patients complaining of any problem with iron transfusion.
Yes, that's right. So it was quite a new thing for me to see. But, Brother Ali, I hope that has answered your question. Perhaps you need to ask for further investigations as to whether you have a underlying malabsorption type of a problem as well. So proper history needs to be taken for that. And in the meantime, we have a Mrs. Nusrat Chaudhry who's joined us. Thank you very much. Welcome, all of you. Again, we have Dr. Azhar Chaudhry who's joined us, Brother Qasim Mahmood. So it's wonderful to have you all on board. The other question I have over here, and we could, like I say, we are sort of a few minutes left, but the other question I have over here is, Dr. Ahmed, could you tell us a little bit about anemia related to B12 deficiency? Can some person take tablets rather than having the injections every 3 months?
That's very common general practitioner question you have put forward.
Oh, I wonder if this brother or sister is a GP. They wish to remain anonymous, but it would be good for me to know. Well, actually, I've seen some colleagues give oral supplements. My thoughts are different, but what do you have to say?
Okay. Let me take through. First of all, if there is a deficiency of B12, which is the vitamin necessary to form the blood, then the red cell becomes bigger, what we call is a macrocytic anemia. So there are two possibilities of B12 deficiency. Number one is a condition called pernicious anemia, where some individual lacks the protein which absorbs the B12.
Okay.
So that condition is not very common. I think it's overdiagnosed.
Right.
The reason is that we haven't got any confirmatory test. I mean, there are some antibodies we test in the blood which can be positive in 40 to 50, 60% of patients with pernicious anemia.
Yeah.
So those patients who have got pernicious anemia, which is they lack a protein which absorbs the B12 from the bowel into the blood, they won't improve with oral supplements at all.
Okay.
They will require, the replacement through intramuscular injections every three months. But I think first thing I would suggest, previously B12 was not available in NHS prescriptions.
Okay.
Although you can go to the Tesco and you can buy a bucket full of B12 for £3-4.
Yeah.
But I think under NHS it was we couldn't prescribe oral B12.
Yeah.
And I think recently it has come onto the formulary that we are able to prescribe B12. So I think in all B12 deficient patients, I would suggest that we try oral supplementation first for 3 months and then check their levels after 3 to 4 months to see if there is any improvement. If there is no improvement, that would suggest that they have got pernicious anemia.
Right.
In that case, we go on to lifelong intramuscular injection. But I think every attempt should be made for oral supplements for B12.
Okay.
I would give good 6 months first.
Okay. Well, that sounds very reasonable. But I completely understand, though, the predicament of people having these injections and we overtreat it, because what usually happens is you get them coming back with repeat blood tests with their vitamin B12 in the thousands, and it's often very difficult. And actually, it's a pointer. Again, a lot of people, the other thing I want to ask is, this is something I would like to ask you, Dr. Ahmed, is that some people who are iron deficient can also be folate and B12 deficient. I've seen a few like that, not very many. And would it be advisable to treat the iron and the B12 would automatically be treated? Is that the assumption?
No. I think these patients will particularly will be problematic with the nutrition.
Yeah.
So they are possibly not taking enough, enough vitamins in their diet, or there's a possibility of malabsorption. So I think we should address to make sure that we have ruled out this condition called celiac disease, that they haven't got any malabsorption. Then usually I think we should replace every. If the B12 is low, we should replace it. If folic acid is low, we should replace it, and iron as well. So giving iron only, not replacing the other vitamins, I think is not the right thing to do. We should replace everything.
Okay. And when you see an initial somebody like that who's got low vitamin B12, would you also suggest giving oral supplementation for B12 alongside oral iron as well?
No. I mean, if they have got only B12 deficiency and their iron levels are normal, then there is no need to give them iron supplements, just oral supplements. I mean, you can do some blood tests, for pernicious anemia, but usually those blood tests are not very helpful.
No.
There used to be a very difficult confirmatory test, which I think these days hardly anybody does it. I mean, we're relying on these days on these antibodies to diagnose pernicious anemia. But I think every attempt should be made just to replace the B12 for a good 6 months.
Okay. Well, as usual, the show has ended, Dr. Ahmed. Honestly, we needed to talk a little bit more about this. Isn't not fair. But we will have you back on the show. Thank you so much for joining us.
Oh, thank you very much for having me on your show. It's always an honor to be on your show. And usually I do learn myself as well from these questions.
Oh, absolutely. And I've definitely learned a lot. So thank you very much, Ishfaq Bhai. And hopefully, inshallah, we will see you again.
Okay, inshallah.
Thank
you very much.
Assalamu alaikum. Assalamu alaikum. That was a wonderful Dr. Ishfaq Ahmad, Consultant Gastroenterologist in the Worcestershire Acute NHS Trusts. Now, it is going to be Ramadan from next week. I wanted to wish you all Ramadan Mubarak, and my shows, as usual, going to be, I would love the pleasure, I would love to give you company whilst you're preparing your iftaris, which are going to take place. My shows from the 23rd of May onwards are going to take place from 8 to 9 p.m. I hope so. And Brother Qasim has promised me that he's going to be giving me iftari on every single day of the week when that happens, which is wonderful. Join us again for another Body Health and Mind show. Assalamu alaikum.
Your number one for local